Imagine waking up one day to discover that millions of older Americans are silently battling a hidden heart condition that could shorten their lives, and many don't even know it. That's the startling reality of valvular heart disease, VHD, a serious issue affecting countless seniors, and it's only set to worsen. But stick around, we're about to dive into the details of a groundbreaking study that sheds light on this growing epidemic, and trust me, you'll want to see why it matters for everyone. Let's break this down simply. VHD happens when the valves in your heart don't work properly, either opening too much, closing too loosely, or stiffening up. This can lead to symptoms like shortness of breath, fatigue, or even heart failure if left unchecked. For beginners, think of your heart's valves as tiny doors that control blood flow. When they malfunction, it's like trying to run a marathon with jammed locks. Now, according to the October 2025 PREVUE-VALVE study, backed by the Cardiovascular Research Foundation, there are at least 4.7 million people aged 65 to 85 in the U.S. dealing with moderate or severe VHD. And if we include those with milder forms that still need attention, that number jumps to a whopping 10.6 million. Shockingly, most of these folks are completely unaware of their condition, kind of like driving with faulty brakes, and not realizing it until it's too late. How did researchers uncover this? The study enlisted 3,000 participants from retail pharmacies nationwide. After initial check-ins, each received a home visit where doctors performed a standard 12-lead electrocardiogram, a test measuring heart's electrical activity, think of it as a heart's rhythm check, and a detailed echocardiogram, an ultrasound of the heart to visualize those valves in action. This hands-on approach helped paint a clear picture of the problem. Plus, to put it in perspective, the American Heart Association notes that VHD claims about 25,000 lives annually in the U.S., a grim reminder that early awareness could save countless hearts. Diving into the findings, the overall rate of moderate or worse VHD among participants was 8.2%, and it climbed steadily with age. For instance, in the 65 to 69 group, it hit 5.1%, rising to 7% for 70 to 74-year-olds, 10.5% for 75 to 79, and a concerning 14.7% for those 80 to 85. And this is the part most people miss. When including milder cases of VHD, the prevalence soared to 18.4% overall, with the oldest group, 80 to 85, at a staggering 31.4% compared to just 12.1% in the youngest bracket, 65 to 69. It's a clear sign that aging takes a toll, but here's where it gets interesting. Researchers used U.S. Census data to predict that by 2060, the number of Americans with moderate or greater VHD could swell by about 1.8 million. That's like adding a small city's worth of at-risk individuals, all because our population is getting older. But here's where it gets controversial. Many with VHD go untreated, either due to limited access to proper care or delayed diagnoses that catch issues too late. What if we could flip the script with better screening tools? Dr. David Cohen, MD MSc, who leads clinical and outcomes research at the Cardiovascular Research Foundation and serves as Director of Academic Affairs at St. Francis Hospital and Heart Center in Roslyn, New York, puts it bluntly, these results highlight how widespread VHD is and how it's poised to grow as more people live longer. He emphasizes the public health stakes, suggesting we need smarter studies to create effective screening methods and ensure everyone can get treatment. Imagine, for example, routine heart valve checks at annual checkups for seniors. Could that prevent tragedies and save on healthcare costs down the line? Of course, this raises bigger questions. Is it fair that so many remain in the dark about their heart health just because they're not getting screened regularly? Should government policies push for mandatory VHD checks in older adults, or is that an overreach on personal freedoms? And what about the counterpoint? Some might argue that overscreening could lead to unnecessary worry or treatments for mild cases that never cause issues. I'd love to hear your take. Do you think improving access to care is the key, or is there a controversial angle here we haven't considered? Share your thoughts in the comments below. Let's spark a conversation on keeping hearts healthy as we age.